explanation of standard drug coverage. Probably the most confusing part of Medicare is Part D prescription drug coverage. Today, we'll take you through 4 phases of the Part D and how they impact the price of your medications. Also, we'll show you how to get insulin for no more than $35. Today's video is about the 2022 Part D drug coverage phases. Whether you have a standalone Part D drug plan or a Medicare Advantage plan, they have to follow the same guidelines. Let's take a look. Here is a visual description of the 4 phases of Part D prescription drug coverage. It's a lot to look at. Deductible. Every January 1st, the deductible resets the maximum to add $480. Remember, a deductible is what you owe for the insurance carrier. So if your plan has a deductible, you will owe the full cost of drugs until you meet the deductible. I say applicable drugs because not all drugs will necessarily be subject to the deductible. Some plans will have a $480 deductible on all drug tiers. All others only have a deductible on brand name tiers. And there are even some plans with no deductible. Next up is the initial coverage phase. Assuming your medications are covered on the plan's formulary list of drugs, this is when your Part D plan begins to pay the bulk of the drug's cost. It's tiered-based pricing. Typically, generic drugs are Tier 1 or Tier 2. Then, brand name drugs are Tier 3, Tier 4, and Tier 5. You will pay a copay or coinsurance percentage until you reach $4,430 of total gross drug cost. Gross costs are what the drug actually costs, not just your portion of the cost. So, if a drug's full retail cost is $100, but you only have a $30 copay, the full $100 is applied toward reaching the $4,430 amount, which gets you into the next phase of Part D. The coverage gap, also known as the donut hole. If you have a very expensive drug, then you can reach the coverage gap very quickly. When Part D first began in 2006, reaching the donut hole was very undesirable as you owed 100% of a drug's cost. In 2022, it's not nearly as bad. You might have heard that the donut hole is now officially closed as of 2020, but that doesn't mean everything is free. Rather, you're still required 25% of a drug's full retail gross cost in this phase. For some drugs, like generics, the cost might not change much. For other drugs, like brand name and specialty drugs, the cost could go up substantially because you're now paying 25% of the full gross cost. It's like this until you reach $7,050 of true out-of-pocket costs, or TROOP. Catastrophic is the final phase. When your true out-of-pocket cost reaches $7,050, you're in the catastrophic phase. Here, for the remainder of the year, you will pay the higher of $3.95 for generics, $9.85 for other drugs, or 5% of the drug's full gross cost. But you don't actually have to pay $7,050 out of your pocket. Most people were seeing that number, thinking that they will never reach that in drug costs, but it's easier to get to the catastrophic phase than you think. TROOP is calculated by adding up these 4 items: your cost in the deductible phase, your cost in the initial coverage phase, your cost coverage gap, donut hole phase, and 70% of the brand name cost in the coverage gap, donut hole phase, which the manufacturer pays on your behalf. As you can see, if you experience all 4 phases of Part D, you'll potentially pay 4 different prices for your medication throughout the year. And keep in mind, you'd only deal with a donut hole in catastrophic phases if you take pretty expensive medications. If your prescriptions are all Tier 1 and Tier 2 generics, then your Part D coverage will be pretty straightforward. Please call our licensed agents regarding any questions you may have. 866-611-0519.